I'm Marilyn Priel with The Better Part. A well-known complaint from school teachers to some parents is, your child would do so much better if only she would pay attention and apply herself. A complaint some adults might hear from their spouse or co-workers is, you don't listen. Why don't you finish what you started? Well, just maybe it's not a rebellious or lazy nature, but it could be attention deficit disorder. A well-known psychiatrist and neurologist will give us some insight into attention deficit disorder, better known as ADD. My guest is Dr. Saad Shakir. He has a long list of credentials, and I'm going to have him just tell you a few. Please meet Dr. Ishod Shcher.
Thank you, Marilyn. It's nice to be here, and you did a good job. Saad Shakir. I'm a neuropsychiatrist in private practice, but formerly an adjunct associate professor, emeritus at Stanford University, School of Medicine, Department of Psychiatry and Behavioral Medicine. Currently, I founded a group practice called Integrated Clinical Neurosciences and Silicon Valley TMS. We are in 3 locations in the Bay Area soon. So we have San Jose, San Francisco, San Ramon, and soon we'll have Santa Cruz office, where we have a team of professionals providing integrated care for people suffering neuropsychiatric disorders.
Describe attention deficit disorder and also the hyperactive part of it.
Thank you so much. That's a pleasure to talk about that, because that's a field that's evolved significantly in the past century, actually. It made its first appearance in the early part of the 20th century. People didn't really know what to make of it. They called it hyperactivity syndrome, minimum brain damage, until in the 1970s, early 80s, it got recognized as a condition of attention deficit hyperactivity disorder. And ADD for short, for people who don't have hyperactivity, but it's classified as ADHD. I call it with a silent H. So inattentive, so you can either have an inattentive component, hyperactive impulsive, or combination. The past 30 years, it's evolved significantly. We used to think it was only kids who have it. Now we recognize it persists into adolescence and adulthood. And we recognize it as a neurodevelopmental disorder related to brain functioning, but affecting different areas, including education, development, relationship, self-esteem, and certainly a very impactful condition that everybody should know about.
What are some of the symptoms that common symptoms that we might recognize in say, our children?
That's an excellent question. Inattentiveness, distractibility, easy boredom, difficulty finishing homework, difficulty at times with hyperactivity and impulsivity, poor decision making. Sometimes they seem as if they are not listening to you, but in reality they are distracted inside their head with some additional things going on. So inattentiveness, hyperactivity, and disorganization would be the main features. Oftentimes recognized by parents or kindergarten, preschool, or grade school teachers. And we're happy because in 2016, most people know about it, so it's easy to recognize compared to when many of us were growing up, where it was not recognized as a medical condition.
It has nothing to do with intelligence.
Nothing to do with low intelligence, for sure. If anything, statistically, most studies show that ADHD individuals have higher intelligence. But it's a neurodevelopmental lag. Some areas of the brain are not as developed as other areas, but they can be outstanding citizens in some of their brain functioning. And very creative people have that diagnosis.
There's a member of our crew, Sal Tostado, who He thinks he has ADD because he struggled with all these symptoms you're mentioning from childhood. He could never understand why. And we just have a little film clip of this that we'll show.
I didn't know I had ADD. I didn't find out until later in my life. Well, I got problems with concentration. That's what. But I kept concentration with those things that I was not interested in. The ones that I was interested in, I concentrated, maybe over-concentrated. Maybe one of my biggest problems is to finish what I was doing. I worked very hard. I worked everything. It was just, I just need the last step. And then I stopped there. Well, a lot of manual things, they're supposed to take a sequence. I have to do this first, then second, third. 1, 2, 3, 4. I would go to 1, 2, 3, and I'll jump to 5, 7, 9. Without noticing, I wanted to finish. I still have problems memorizing things word by word. The way my brain works, I see the concept, not the words. So in school, I went to a Catholic school. Catechism was very important. And in catechism, you have to learn word by word in a sequence, answers and questions. I never made it. I had bad grades. So my parents said, "You're not good for college. You better start a trade." And well, your father is in the photo engraving and printing business, so that's not bad. We can guide you through that. And they did. Well, I found out that I forgot things. So I always rely on somebody else to remind me of those things. When I was a kid, I was fortunate to have a nanny, so that's where it started. It all started with my nanny. Then I had secretaries, I had my wife. So I always had somebody to remind me of those little things that I wouldn't forget. My daughter was diagnosed with ADD. Then I said, well, I got the same things. And ADD is supposed to be hereditary, so I want to check with my doctor. I went to my primary doctor. My primary doctor said, "You're okay. Your problems, everybody has those problems." Maybe he had ADD himself. I turned my television on PBS, and they had a documentary about ADD. Immediately I found out that I had ADD. This was the best news I've had in my life. I learned how I was.
Great.
Now, is it often the case that people with ADD might have other neurological disorders like obsessive compulsive disorder or Tourette syndrome or autism?
Great. I love to talk about that, but let me make a comment about Sal.
Okay.
You know, it's so often hereditary factors are important that I jokingly say it's so common you get it from your kids or your grandkids.
Oh,
and
well.
People chuckle and says, "What do you mean?" I said, well, nowadays if a child has it, then the parent says, "Oh, I've been like Johnny all of my life." And then they come in, or grandparent comes in. So it's really, really significant to have people recognize it because the disability does not stop as you get older. The biggest, to your second question, is does it exist with other conditions? Absolutely. One of the biggest studies that has been done in children with ADHD was from Harvard University, and they studied about 600 kids to see what percentage of them are only ADHD versus other conditions. And I think most of the audience will guess probably a small percentage, and that's accurate. Only 30% of 7 to 10-year-olds had pure ADHD. Oftentimes it coexists with oppositional defiance disorder, anxiety and depression, very common once puberty sets in, substance abuse, bipolar, autism spectrum, OCD. It's absolutely a common coexistence with ADHD. There's also one other area which I want to address, which is learning disability. See, learning disabilities are separate from ADHD, but they're frequent travelers together. So if a child has ADD and is having difficulty learning in a certain way, they should have that evaluated also.
So then it could be common then initially for a child to be diagnosed bipolar when it would be maybe a combination of two other disorders, or do they coexist with bipolar?
That's a very loaded question, so let me address that carefully. Bipolar is an underdiagnosed condition. However, I think there's been a trend to prematurely call children bipolar without really evaluating the ADHD component. Statistically, ADHD is a commoner diagnosis than bipolar. But because they look similar, I think it's really important to have a specialist make an accurate diagnosis, because it can make a big difference whether somebody is bipolar or not, because the treatment is very different. Would you like me to elaborate on the difference?
Yes, please.
So ADHD symptoms are persistent. They're there all the time. They're inattentiveness. The bipolar component are episodic. So if you have a parent tell you, my kid is perfect, and occasionally he or she flies off the handle and has rage or can't focus, but they are a superstar in the classroom, very likely that is in favor of the bipolar. Where the difficulty is when they have both. A lot of times I see teenagers who come in with one diagnosis or the other, and they are lost in between the two diagnoses. So I always make a point, if a specialist diagnoses bipolar, you really need to treat that first, because the ADHD medication can destabilize a bipolar illness. But ADHD is a safer bet and a commoner condition than bipolar, but I think it's good to be cognizant that bipolar can happen in some kids.
Okay. And then talking about medications, are there some medicines that are taking for other physical problems that can be symptomatic of these neurological disorders? And also, are there certain health, I'm thinking of like some thyroid or maybe hypoglycemia that would cause symptoms similar to these neurological disorders?
Absolutely, Marilyn. Let me backtrack a little bit. And in the introduction I mentioned I have an integrated practice, which we really look at the whole person from every aspect. So our evaluation before we make a final diagnosis includes a medical workup, includes checking. There are definitely medical conditions. Thyroid is one, an overactive thyroid, vitamin deficiencies, nutritional problems can manifest, using sedative stimulants excessively, like too much caffeine. As they get older, if they start abusing street drugs, many of those look like ADHD, but we really have to take a good history, good physical exam. We have to make sure that it's not chemically induced or produced or a medical condition exists. So we always recommend that, because if you miss the diagnosis, you could be labeling somebody with a diagnosis they live with all of their life. One might have been another condition that's easier to treat.
And then they're getting maybe something that's counterproductive with their treatments.
Absolutely.
Well, what are some good treatments, and also is there therapy?
Yes. So once we establish the diagnosis, we look at the component, we design the treatment to the individual. A lot depends on what stage in life we made the diagnosis. Like in children, one very important component is accommodations, which means if they're unable to learn a certain way, they might need accommodations like taking a test in a quieter area, maybe longer time for projects. And one of the victories in the ADHD community is it's recognized as a disability by the Americans with Disabilities Act. So one thing I would do with a child is give them a note and provide information, whether it's grade school, middle school, high school, So that's one component. Very important component, which is why I'm here, is education of the family, of the community. This is not something to be ashamed of. It's a condition that's treatable, recognizable. So your show is going to help a lot of families understand that, because you need to provide empathy, not punishment. If a kid is having a hard time listening to you, it doesn't mean they're being defiant. It could be that they're not really registering your message. So education, accommodations. Then there is the behavioral and psychological interventions. So what do I mean there? So maybe special tutoring if they have difficulty listening in a certain classroom, that could be helpful. Behavioral interventions would be social skills training. Exercise is really, really important. Appropriate nutrition is really, really important. Make sure you monitor who they're hanging out with, because nowadays, especially with teenagers, those kids can end up being bullied or, you know, maybe attracted to the wrong crowd and get into drugs. And then there is the medical interventions. My subspecialty is the medical interventions, which means, are we going to put them on medications? And my message is not everybody needs medications, but if they're disabled from the ADHD, definitely medications can be very helpful part of an integrated program. And we have a variety of medications. Many of them have been around for a long time, but now researched and repackaged to be user-friendly, if I may use that term, where they're longer acting and they're less side effects. Some of them are controlled substances, some of them are non-controlled substances, and I'll be glad to get into more detail with the medication option. We also now are happy to tell you there is magnetic treatment also. There's new cutting-edge treatment called transcranial magnetic stimulation. And we have a center where we have machines that don't even use medication, but they're being studied for stimulating certain areas of the brain that are not functioning appropriately with conditions like ADHD and depression, OCD. So it's really an amazing field. One more thing I want to mention is brain retraining. So there is now evidence that we can diagnose some complicated cases with electroencephalogram, which is a tracing in the brain. We have a tool called QEEG in our office, where we do a 20-lead EEG, and we identify that kids with ADHD have certain dominance of the prefrontal area of the brain, where the brain is essentially hijacked when they're trying to concentrate. And we can retrain the brain. So the nice thing, the treatment is called neurofeedback, where it's like a tutoring club. They come in, they play like a computer game, but there's a psychologist and a trainer with them to help them learn to put the brakes on if they're being impulsive or they're being distracted. It's really revolutionized how we treat those conditions. And we're only at the tip of the iceberg. This is going to develop more and more. So I urge your audience to get appropriate diagnosis of their kids and get them treated.
Teaching the families how to cope, this is important too, as you mentioned.
One thing we do is sometimes, we don't always do neuropsychological testing, but we have 3 psychologists in our practice who can. If the kid has a certain pattern of learning, if they are more auditory learner versus visual learner, we try to coach the parents and the teachers on how this kid is most receptive to the information. We also tell them, don't be automatic in your response to their behavior. That's where a lot of kids get inappropriately punished or put in a corner of bad behavior, when the parent might really need to be more aware and understand that this kid, and I can tell you stories. I mean, I've also coached kids' sports, and I can tell you those kids that pick up daisies on the baseball field should be evaluated for ADHD, because they might actually be losing the instructions from the coach as to what they're saying. And you don't really punish them. You have ways where they can be engaged in the process, the way you talk to them.
So I've read that there are a lot of very famous people who've had symptoms of ADD. Stephen Hawking, Leonardo da Vinci, President Eisenhower, Winston Churchill, Mozart. Well, we don't know. They didn't have doctors looking into that then, but apparently they had the symptoms.
The brain is an amazing organ. That's why I love the brain. In case you haven't noticed. So this is the brain. If you really look at what we know now with the modern science, we know 10,000 more than when I was going through medical school. And that was in the dinosaur age. Okay? So we can tell you each area of the brain. So if you look at ADHD, you see this is the right side, this is the back of the brain, this is the front. The prefrontal area of the right hemisphere is most implicated in an area called dorsolateral prefrontal cortex. So if you go, there are billions of synapses there. If you go inside them, there is a dopamine. You hear of chemicals, dopamine, norepinephrine, serotonin. There is a dopamine deficiency in the conduction in those areas. So people get distracted, disorganized, but to compensate, other areas of the brain really take over. So oftentimes, if the kid is untreated and goes into adulthood, you have anxiety, obsessive tendencies to compensate for that. So keep in mind, if they're smart, the rest of the brain is working really well. If in some areas, and we know not to generalize, but the right side of the brain is considered the creative brain versus the analytic on the left side. So a lot of creative people, whether they have ADHD or not, have very well developed ways of expressing themselves. A lot of the artists have it, but also a lot of the famous politicians and others have the condition and they compensate. So just think, if they didn't have the diagnosis of the treatment and they did arguably well, I mean, you can certainly politically criticize some of those people, but they were able to do it. Just think of what the brain can do when this area is appropriately managed.
My goodness.
It's remarkable.
Well, can that part of the brain ever be damaged through, say, concussions or maybe during childbirth? Or do they know what causes?
Well, I think you're raising a great question. So there are 4 things we look at as to what contributes to ADHD. Certainly, neurobiology is one, which I touched on, the norepinephrine and dopamine. But brain damage is definitely, we're now seeing, one of the other areas I work with is pregnancy and women's health in pregnancy. Because there's more and more evidence if the mother is ill in pregnancy, or taking certain street drugs or prescription medications, everything goes to the placenta, to the brain development of the baby. And there's evidence, for example, that alcohol, tobacco, street drugs can have damaging effect on the brain and produce ADHD syndrome, autism spectrum, etc. There's also evidence of trauma in early childhood. Let's say premature birth or complicated birth where the cord was around the neck, or ischemia to the brain in delivery. Those can have an impact. There's also syndromes that can happen after they're born, if they were born normally. So head injury. Now, as you know, concussion has been a big item on the news because the brain is a delicate organ, and if you bruise and damage that area of the brain, whether it's a baseball hitting in that area or a football injury, it can certainly affect attention. We see a lot of TBIs now, traumatic brain injury, with veterans, with sports related, so absolutely. So then genetics we talked about, and so these are kind of gives you the full range. One other thing I want to address, which you didn't ask, is the syndrome of inattentiveness can be caused by other medical conditions. But to diagnose ADHD, you have to have an indication of development in childhood. For example, I saw a young man who came to me and he was a perfect A student, no problem, and he developed attentional problems in his mid-20s for the first time ever. And I confirmed with family member. That condition was caused by anxiety, not ADHD. Older people sometimes, I see people in their 50s and 60s who come in and says, Doc, I think I'm having dementia or Alzheimer's. And when I really evaluate them, they don't have a degenerative condition. They have an accentuated ADHD that's getting worse as we age. That has never been detected earlier. So the treatment really is going to change significantly.
This has been wonderful. I'm so happy you came to explain to us some things about ADD. And I hope you'll come back and teach us many more things about these brain disorders, neurological disorders. I call them all kinds of things.
I think we're more into looking at them as interconnected rather than segregated conditions.
Okay.
So, like I emphasize when somebody introduces Dr. Shakir as a psychiatrist, says, yeah, thank you, I am board certified psychiatrist, but I'm trained in medicine, neurology, and psychiatry. Because it's important to recognize the head is not a detached organ. The nervous system is every millimeter of the body. And if you have nervous system disturbances, whether it's biological or electromagnetic, it can impact you with pain, with medical conditions. So I am really delighted to let you know that the mental health spectrum is part of physical health, and it should be addressed in similar ways and not discriminated against, because we can make superstars in individuals who might have difficulties because of their genetics or their background. We can fix that. As a matter of fact, a lot of the famous athletes have ADHD. You didn't ask me about that, but I volunteer, like Olympic stars or superstar basketball players, because if they compensate and they excel in a certain area, they're really wonderfully adjusted people. So my message to your audience is look at it in a full spectrum way, evaluate medically, psychologically, behaviorally, neurochemically, and fix all of that that needs to be fixed.
That's wonderful, and I'm glad you're doing that.